Hello and welcome. I'm Dr. Adrian Blow, and I am the president of the American Association for Marriage and Family Therapy. And I'm honored to moderate today's LinkedIn Live event that's hosted by AAMFT in recognition of Mental Health Awareness Month. We have a fantastic panel with us today. And so thank you for joining us for this very important conversation on the mental health crisis affecting children and teens today. We're thrilled to have a group of panelists who come from diverse backgrounds and disciplines and who work closely with children and families and their communities and help them navigate things like anxiety, trauma, parenting, stress, and more. Today's conversation will specifically explore rising anxiety rates, the impacts of social media, trauma exposure, parenting stress, and real strategies families and communities can use to support youth mental health. So it's a wide range of topics from a great panel. I'm really looking forward to hearing what they have to say. I've asked each of the panelists to introduce themselves just for 1 minute each, and they're going to give their name, title, area of focus, and one issue that they're most focused on right now when it comes to youth mental health. So we're going to start with Paul and then go around the room after Paul. Thank you.
Thank you, Dr. Blow. It's a pleasure to be here. It's a pleasure to be here with my esteemed colleagues. So my name is Dr. Paul Hokemeyer. I'm a licensed marriage and family therapist. I'm a graduate of the Harvard Medical School's Global Leader in Healthcare program. And my area of focus is on identity construction, how our kids manifest their identities, create their identities internally, in relationship, and in the larger society and culture. So that's who I am.
Hello, my name is Octavia. Thank you for having me. I am a licensed marriage and family therapist and director of training and development with Disruptive Therapy Collective based out of San Jose. Major area of focus is somatic healing, especially in terms of trauma and just trying to come back to zero, navigate through, I guess, having a safe body in this world today. And that's a little bit about me.
Hello, everyone. I'm excited to be here. My name is Corine Lurry-Mabin, and I'm the president and CEO of Andrus, a nonprofit organization in Yonkers, New York, where we really focus on social emotional well-being for children, families, and communities, and organizations really having an understanding of the impact of trauma and supporting communities in healing and thriving from trauma.
Ashley Graber, and I'm a licensed marriage and family therapist, co-author of Raising Calm Kids in a World of Worry with Maria Evans, and a parent coach. And I focus now on guiding parents to lead with steadiness, not solutions, so that kids can feel safe in a world even when it feels shaky.
Hi, everybody. I wrote that book with Ashley Graber, Raising Calm Kids in a World of Worry. My name is Maria Evans. I'm an LMFT and adjunct professor here in Los Angeles. And I have a private practice here and see children and teens and couples and parents. And my big focus is, how do we help kids feel safer in a world that can feel unpredictable and overwhelming? And it really comes down to creating a culture of closeness together and focusing on relationships. And so we're very excited to be here and share with you today.
Well, thanks everyone for introducing yourselves, and I'm even more excited now for what's to come in our next hour. We are on a time schedule, and I've asked each of the panelists to be mindful of the time as they respond. We have 5 segments we're going to get through today, and the first one is to understand the mental health landscape. So just kind of what's going on in the mental health landscape in general. And this is going to take about 15 minutes. And my first question is for Ashley and Maria. And the question is, anxiety rates in children and teens have skyrocketed, doubling during the pandemic. From your perspective as therapists and authors, what do families need to understand about what's fueling this surge?
Sure. Well, first of all, you've heard of the 24-hour news cycle. And now I think we would all agree it's not even a 5-minute news cycle. You know, one glance at your phone and there's a new crisis unfolding, and there's just so much more access to technology, so many more endpoints than there ever were, and parents are under constant stress, and the landscape of parenting is so different today than it ever was, especially with how technology is evolving faster than we can even keep up with, between AI and social media and everything that's continually coming up. And so parents are overwhelmed. There's genuinely more stress for kids and for parents, and we are getting better at noticing and diagnosing, but largely it truly is rising.
And social media plays such a massive role. It not only exposes kids to comparison and unrealistic standards, but it's eroding natural downtime that kids need for their brains to recover. We know it shortens attention spans and amplifies social pressures. And it's especially important during these tween and teen years.
Yeah, so we really feel for families that are going through this right now. And Ashley and I, we're parent coaches, and we have parenting groups, and we see kids and teens in our practices, and all we hear about is, how can I help my child feel less anxious in a world that I don't even know how to protect them from? What do I do? I mean, I myself don't have the answers. So how am I supposed to stay calm and regulated and give them the answers? And so that's the big question that we sought to answer in our book. And that's what all clinicians are really curious about right now, is how do we create that for them?
Mm-hmm. And there's also the aspect of disrupted routines, whether it's from the pandemic, shifting school schedules, or this sort of always on culture, that it's stripped away the predictability that really helps kids to feel grounded. And without those anchors, even small stressors begin to feel really unmanageable.
Yeah, so we're really asking kids to develop in environments that are overstimulating and under-regulating in a world that feels shaky. And so if any of us even stop for a moment, we might notice that our own anxiety levels have risen. So why wouldn't those of the kiddos,
And just to touch on perfectionism a little bit, it's also kind of quietly crept in. Many kids believe that they have to be the best at everything, whether it's school or sports or friendships, and even their emotions. And we see a lot of kids feeling that are anxious about feeling anxious, and it can create a loop of self-doubt.
Thank you. Those were fantastic responses. I have a follow-up for Octavia and Corine. Nearly 1 in 5 kids have a special healthcare concern, and trauma, whether it's personal or systemic, continues to shape youth mental health. At the same time, school shootings have nearly tripled since 1999. How did these types of realities shape how children and caregivers experience and then deal with trauma today?
So community trauma in and of itself, it mimics what we as individuals experience trauma. So what's happening in our bodies also plays out in the community. So one of the things that we really need to focus on and look at is, how do we recreate safety within communities, within individuals? How do we help restore some of that safety and some opportunity to kind of envision future? It doesn't have to be perfect. We know that perfection doesn't exist, but really looking at ways of how do we restore this safety. And one of the things that it's actually a model that we use with different communities and organizations. It's something called the self model, and having conversations with communities around talking about the safety aspects of a situation, talking about the emotions connected to the issue, really acknowledging the loss and giving room for the loss, and then also connecting, having some type of connection to future. Not necessarily always coming up with all the solutions, but having some conversation around what future could possibly be, and ensuring that within the communities, that everyone has the power to heal that community. And so pulling in voices from the youth, from the teens, we don't, sometimes we as adults, we go right in with, like, we know exactly what to do. And with children and youth experiencing mental health, they may not always be able to connect words to what they're feeling, but they know when they have this sense of safety. So pulling them in to make sure that they're part of the conversation, as well as other members within the community. So schools, hospitals, police departments, other nonprofits, places of worship, to really work together to find a way of how they could heal as a community. And as the community begins to heal, the individuals also are healing as well. So it's important that it's a collaborative approach. Relationships are key, as Maria and Ashley had referenced. And finding the shared language, and what, as I said, what we use this self model as a shared language, as a tool for communities to talk about the trauma experience.
Absolutely. I'm gonna piggyback off of what Corine is saying, because I think we've gotten to a place where we are constantly looking for the danger. And again, with school shootings rising, we are living in a world that is very shaky, that Maria and Ashley have referenced, but we also don't teach kids to look for safety. I mean, I have to be able to create balance in my own life using that self model. And if I'm highly, highly aware of the danger, my anxiety, my feelings, my thoughts, how uncomfortable I am, then I need to know the other side of that. And I think that's the part that we kind of leave off. I think as adults, even referencing myself being raised, you know, that's left for when you're older. You'll figure that out when you're older, right? Your parents create a certain amount of structure and you go along with that, and then we leave that where it's at. But, you know, in a world where we're raising kids to be highly aware, I then have to give them more knowledge to go with that. And so I need to teach you how to find your own safety. Who is a safe person? And when that person is no longer safe, when that place is no longer safe, we have to replace that. Right? I can't then go off and continue to dysregulate on my own and feel uncomfortable in my own body, because that then leads to a trickle down effect. So I think trying to give not just kids an idea of, you know, this is what it feels like to be in a world that is completely unsafe, and how can you create some semblance of safety here and there and recognize it, but also giving parents or, you know, key adult figures in kids' life, you know, foster parents, adult figures in children's lives, an idea that, hey, you know, you got to finish some of these thoughts that we're having. What you're feeling, they're feeling. What you're witnessing, they're witnessing, right? And so kind of recognizing kids are humans. They may not be fully adults to fully understand how the world works, but they are still here in it with us. And so I think sharing, this is uncomfortable for me as well, and so let's figure out how we can make this feel better, right? Pulls them in to practice this so that they can do this as they get older.
Love what you're saying. And Maria and I talk about this so much, and how to have these difficult conversations. And it is one of the biggest questions that we get, which is, should I tell my child about X, Y, or Z? And we're big proponents of, yes, in language that they can understand, not overwhelming them, and noticing how it's affecting them to hear the conversations, but that having conversations that are really hard is so important, because kids do know, and they do, just like what you said, what you both said, they do have to be prepared and understand what's happening. They usually know what's going on anyway. And oftentimes adults and parents and caregivers can give information that helps lower anxiety versus heighten anxiety in the unknown.
Absolutely.
And I think the other piece that's important is that allowing the youth to have a voice in regards to what type of therapy they want to participate in. You know, we as adults say, okay, you should be going to speak to this clinician. And some of the therapy may be rec therapy. Some of the therapy may be going out and, you know, walking in an environment in nature that they're not necessarily used to or connected to or have access to. So how do we create opportunities for access to different type of healing opportunities? But I keep going back to allowing them to have a voice in it and not shutting them down when they say, well, no, I don't want to, I don't want to do this. I don't want to go speak to this social worker or this family therapist, and just to explore with them. Okay, what would you like to do? Because children, once they feel safe and connected, they talk, they speak. It could be over a basketball, shooting hoops. It could be over, I don't know, playing on a swing set. It could be jungle gym or whatever it could be, just because, as we know, children need to be active sometimes when they're talking about some of these difficult or sensitive areas in their lives. So you want to explore that and give them opportunities for that as well.
I love that idea of agency, and also letting kids and teens, they love to be let in on little tricks and tips and understanding psychology, and just letting them know that anything that they're doing with their senses, with their hands, sports, moving their bodies, dancing, is already activating that prefrontal cortex. And a lot of the time they're already doing those things. So it's not like you're adding a whole brand new skill set, but in some way it's just having them even do a little audit of their own life and go, well, here's what you're already doing to bring calm. So what else could you do that's like that? Or how do you make that your own? Or, we love to have kids make playlists, and label them based on their moods. And there's so many creative, fun ways to do it that doesn't have to feel so didactic or even therapist-y, or whether they're in therapy or not,
We teach that every member in the community has the power to heal, to help that individual heal as well as the community heal. And I tell teams that don't get hung up on the titles behind the names. It's about the relationship, and every part that you contribute to the system is important. So it doesn't matter if you are a part of the custodial team or part of DPW in the communities. You have the power to heal, and how do you help in making those connections with the youth?
Excellent. I was smiling at the playlist because my daughter, who's in college, texted our family asking each one to give a song as she went through finals, and I was like, "Well, that's a perfect strategy to come up with a playlist to help you through a tough time." All right. Well, we're going to move now to our second segment, and so hopefully we'll tie some of these thoughts together at the end. And the second segment is on navigating the role of technology, and we know that technology is everywhere, and that ding on our phone or that red light like reels us right in, and then we're kind of pulled into this vortex that we can't get out of for hours, it seems. So this is the next question, and we're going to start off with a question for Paul and then for Ashley and Maria. And this is the question. More than a half of US teens spend 4 or more hours a day on social media. Wow, that's staggering. What are the biggest mental health risks associated with digital use, and what role can parents, educators, and therapists play in managing it? All right, over to you, Paul.
Thank you. I think in particular, we have to look at the technology and how it impacts our central nervous system, and it's highly activating. And we know that our kids are highly reactive to begin with, and part of the process of parenting is getting them to move to a place of intentionality, right? We want them to be intentional with their lives and to reduce the amount of reactivity. And so constantly being stimulated, constantly being connected to things outside of themselves that are hyperstimulating causes them there's a number of health impacts, right? Low attention span, problem in interpersonal relationships. And so we want our kids to be grounded. And I love what I heard my colleagues talk about, particularly Corine was talking about getting outside and like just putting your feet in grass is incredibly grounding. My mother-in-law's from Russia, and she suffers from anxiety. She loves anxiety, and so she'll go out. I'll see her in the backyard, just like walking barefoot in the ground, and because that is incredibly grounding. And I think that we're aware of the fact that technology is having an enormous impact on our lives and our relationships. And I think we need to be conscious about pushing against that. And so we need to go back toward being intentional in our relationships. And I, particularly in my work, have been rereading works of Carl Rogers and the humanistic psychologists that talk about the power of human connection and how there is such force and power in unconditional positive regard, and the power of two human beings being together in the room and connecting to that energetic field is extraordinary. And from a physical standpoint, right, we know that our body produces a lot of what's called endogenous opioids, which are really good things because it keeps our kids away from exogenous opioids, which we want them to stay away. Things like dopamine, serotonin, oxytocin, we get those in relationships with other human beings. And so I think that we as parents need to be very intentional about minimizing, saying that this is a technology-free zone. And this is a time when we're going to sit together as human beings and be in each other's presence energetically. So that I think that's what I have been doing in my practice and in my own life too. I have been really focusing intentionally on spending time with other human beings, like in a room together. So that's kind of where how I'm approaching this.
Mhm. Yeah, thank you for sharing that. I think the thing that's so hard is screens are here, and it's part of what kids know. And it isn't just as much that they're on the screens, but what it's really displacing, which is so many things you just said, that connection, the rest, emotional regulation. And we see kids who think that their only way they can settle their nervous system is to be on a screen. And it will ask, and that's what they say, is that that's how they calm down. And the most powerful tool we can offer is modeling. And this one's always a funny one because parents are often also working, and they'll say, well, but I have to get my work done. And so what kids see is a parent on a phone or on a computer. So the families have to come up with compassionate boundaries around it and know that it's not about being flawless. It's about that the boundaries aren't going to be perfect all the time, but really sharing that there's specific times. And I think you mentioned this, that can we have screen-free meals, certainly at bedtime, and really giving kids plenty of unstructured, tech-free downtime. And this has been mentioned before in the earlier segments, and from Paul, that they really do need to get outside or do something that isn't in front of a screen to not only let their nervous systems regulate, but also just to have time away from it and really be able to find calm doing other things other than being on a screen.
Yeah, such good ideas. You know, we know from the research that kids are having experiences much later now than they normally would. Even research about dating and kids going on their first date, or even expressing interest in others, or going to parties or going to friends' houses. These experiences have significantly decreased in large because of tech. And what we know is that kids are still developing, you know, preteens and teenagers, they're still growing, they're still learning the most important skills that they need to be compassionate, communicative, empathetic adults. And if they don't get those peer experiences out in the real world, and they don't get those experiences with their families, talking in person, in the living room, in the backyard, going for hikes, walks, then they're missing out on that socialization. So in addition to really modeling that in your home, think a big part of it too is figuring out what is it that your child is really interested in, and how can you get them involved in that more on with, hands-on on the ground. And it's very hard to compete with that screen. It's very difficult. Teachers will say how hard it is to keep attention now because everything is more interesting under that bright light, even if it's the same information that's being communicated. But really figuring out what kids are passionate about, what lights them up, and then getting them out there doing it, getting them excited about creating a project or something art related or music related, or even a little business idea, or getting a few kids together and setting up a stand somewhere. Just anything tactile truly is going to go a long way. And then being honest as adults about that pull of technology for us too. I mean, Adrian, when you brought this up, you spoke about us and we, because we're all victims to this in some way. And so being really honest and saying, wow, I can tell I just put my phone down and 2 minutes later, I want to pick it back up. This thing is very addictive. I can feel it. I can feel my brain thinking about it again. Do you ever notice that? And starting to have conversations about the true impact of that and that pull, because if we're not honest about it, then how are we going to combat it? So getting the kids in on the conversation.
Yeah, thank you. And I just wanted to ask, this is a fantastic point. I just wanted to ask Paul, can you get the good opioids from social media?
You can get them, sure you get them, but they're really intense and they're really quick. And they leave
I
really
see, okay.
So there's
Okay.
like an addictive quality, right? Which is tolerance. So you need more and more and more to get the same baseline level of satisfaction. And then there's the withdrawal, which Ashley and Maria were talking about, right? Where you put the phone down, you're like, oh my God, I need it. So yeah, you can. We like the other ones. We like the relational ones better though, because they're slow and subtle and they teach us the importance of relationships.
Yeah. Thank you. And I have a follow-up for Octavia. So how are you seeing technology affect vulnerable youth in particular, especially those with trauma histories or limited support systems?
It's a really good question. I mean, I start with a dysregulated system is always going to continuously look for threat. And so what that really looks like is I am always going to try and find affirmation that something's wrong, something's happening, something's going on, right? That's kind of the purpose of my fight or flight system. Once it's activated, I'm supposed to look for threat. I'm supposed to be aware. I'm supposed to be on alert. As a kid, the adult that is my safe person in my life is the one who then tells my nervous system, you're okay, we're okay, I've got this. The safety is here. That might be concerning, especially from your viewpoint, but don't worry about it. For those who don't have that, or maybe they don't get it enough, I'm going to look to my peers. Most kids spend majority of their time in the school system with their friends. So I'm getting information, whether or not I have access to a device or not. I'm going to get it from my peers and I'm going to constantly receive that information. So if something's telling me all of these terrible things are happening, right? We hear how kids talk with each other. It's all about the tea. It's all about the gossip. This drama is happening. So-and-so did this. Did you hear about this school shooting? Did you hear about this shooting in the neighborhood? Did you hear what's happening now in our economy and our government? Right? Kids talk and they repeat what they see online and also how we express things in the home. So, and even honestly, I imagine school staff, teachers are also talking, kids hear that too. So, the way that they're interacting with the world, something's telling them it's not okay, it's not safe, I should be on edge. What it tends to look like is you'll have kids who are really avoidant, who are really terrified to try new things. And that's majority of childhood, right? I don't know much about life. Much of the world is me trying new things, but kids are very avoidant. Because the way that things have been expressed is everything is scary. So I don't want to try new things. I don't want to put myself out there. I don't have the ability to connect with something that could be very calming for my nervous system because I'm terrified of possible negative outcomes. On top of, how do I then communicate to others that there's something that I need when I don't have the verbiage and the language for that? If I'm only giving doom and gloom, right? And I'm not going back to how do I seek safety? I don't even have the language to ask for what it is that I need. I don't even know how to identify that. So we're leaving kids in these perpetual dysregulated nervous system states. They are very defensive. They are very reactive. They're highly avoidant. They're not absorbing information sitting in school systems at all. And then what's the response that they get from the adult world, right? We either blame them or shame them. We're very angry with them. Why don't you do what I want you to do? How come you're not X, Y, and Z, right? And so there's shame. And now that's also kind of bubbled and intensified what's happening for their little nervous systems on top of that. So then you have a kid with all these behavioral issues, right? And then now we as parents are also picking up some of that shame because what am I doing wrong that I can't do X, Y, and Z, right? So we kind of keep this cycle going around and around versus what Maria and Ashley and Paul have said is I think we just kind of need to acknowledge like we all feel off and maybe I need to disconnect and I need to go outside and I also need an outlet and let's do it together and let's figure out what that could be. And maybe for our family, we don't do 7-hour hikes or, you know, maybe we don't go to the beach, but maybe we play basketball. Maybe we play board games. Maybe we do chalk outside, you know, maybe we cook outside, right? I think it doesn't necessarily have to look like what we're seeing online, right? Keep in mind, there's adult influencers coming for us as well, telling us this is how we should be navigating our own nervous systems. But it just has to feel right for you and your family. And I think exploring that and being okay that some things might work and some things might not, it's just kind of where we need to start.
Beautiful.
Thank you. Okay, we're going to move now to our third segment. And this, even though it may seem like a long time ago, we can talk about the COVID-19 pandemic. It feels like a lot happened since then. I have a question for Corine and Paul. COVID-19 disrupted routines. We heard how important routines were, limited access to care, and intensified feelings of isolation and fear among people. What lasting mental health effects are you seeing in children and teens? And what should therapists, parents, and schools be doing to help them to recover?
Corine, take it away.
So I think the biggest piece is just this uncertainty with the youth is, you know, okay, is this going to happen again? How do we manage this? We were on this period of the entire world, it felt like, was kind of shut down and you were isolated and being pulled away abruptly from your peers, being in different environments where you may not necessarily always been the healthiest environment for some home lives for some of our youth, and now they are stuck there. Sometimes schools were safe havens for our youth, and now they're no longer able to even go to school. So in and of itself, that fear of, okay, will it happen again? This what we would say almost like this post trauma type fear that is happening, occurring for our youth. I think one of the things with not being able to have control, or this fear that they no longer have control of what's going to happen around them, and really looking at ways of, okay, what can I do to kind of help cover those feelings if they can't manage them? So this anxiety, sometimes what we're finding that youth are turning more and more to substance misuse, and really how do we support them around that with some of the therapies looking at co-occurring models that's working on addressing the mental health challenges for that youth as well as the substance misuse. So they're that's some of the things that we're finding, that they're turning to substances, and with the legalization of marijuana and other substances that are out there that our children are getting a hold of, just to kind of mask some of those intense feelings that they are struggling with. So I'm seeing that, and that's from the, as I said, from the mental health aspect, but from the academic lens and realm, a lot of our children are, because of the pandemic, they are behind. So especially children who already are managing some of those behavioral health challenges in and of itself, and then have to learn how to learn via screen, go to class over a screen, that was traumatic. And we as adults had to figure out, okay, how do we do this? How do we connect with our youth and teach them and force them to sit on a screen to learn versus just sitting on a screen and just kind of scrolling. So that was traumatic for them. So we're seeing that children are several grade levels behind in reading and math, and just once again missing out on this human interaction and contact. So really learning how to reconnect and how to engage with peers and how to work on those social skills, because a lot of that was disrupted when during the pandemic. So how do we kind of help restore that as well?
And I'm going to take a direct quote from my esteemed colleague, Octavia Neal, and say, a disrupted system will always look for a threat. And so I think if we look at the pandemic itself, I think we all remember where we were. I certainly do. March 15th, 2020. The world was falling apart, right? There was this virus. Nobody really knew where it came from. There was all sorts of discussion about it was intentional, right? That we didn't know how you got it. We knew that people were dying, right? The media was full of images of New York City in particular, of people just lying to, like the morgues were just outside, and like I'm getting anxiety just talking about it, right? And so I think that all of our systems, and I think Corine spoke about how that we need, when we have trauma, we need our parents, we need systems to come in and tell us that we're safe. And all of these systems were falling apart. And then the media was actually causing a lot of disruption and conflict, where if we look historically at world events that have been traumatic, World War II, for instance, right? America came together as a unit, and we're like, we are going to fight this together. Well, that was not the case with the pandemic. That science, right, that the very things that we look to for stability and guidance were called into question. The efficacy of vaccines, the efficacies of face masks, that it was the reality of the disease, right? So we're living in this very fractured world where we can't really figure out what's true and what's not. And if you can't figure out what's true or what's not, how are you going to create systems to address it? And how are you going to get healthy coping mechanisms? And I think that we're still managing the trauma from that. And we still have not been able to come together as a country in particular. I place a lot of my work, we're family therapists, so we work systemically. And so part of that is looking at the systems that we as individuals and families operate in, and the systems that we are working in now are under a state of enormous disruption. Democracy is being called into question. And so the very things that we used to look for protection and stability are being called into question and are being told that they're ineffective and that they need to change quickly. And our central nervous systems don't have time to catch up to that. And so I think that we have PTSD from post-traumatic stress disorder, where we have a heightened awareness of being unsafe and at conflict with other human beings in the world. And that's not a healthy place to be. And this is why I think that we need to return to humanistic values, that we need to look at each other with unconditional positive regard and pierce these labels of others that has come to define our society. Well, you're a Democrat, or you're a Republican, are you Black, are you white, are you Jew, are you Muslim? Are you an immigrant, are you American? We have all of these labels of others, right? That are being defined, that are being used to cause division in our society and our culture. And I think that we need to recognize, and the internet is adding to that, because we don't have the capacity to be present with another human being. And through AI, we're being segregated into interest groups. right? And so we're kind of in this feedback loop where we're hearing things that confirm our suspicions. And so I think that we can pierce through that. And I think that we have to take control over our lives and be intentional in the relationships, in our human relationships with other human beings, and sit with another human being and share the connection that we have from being human beings, as opposed to being disconnected from labels of others that are being put upon us. They're being put upon us. And so that's part of this process of being intentional as opposed to reactive with our lives.
I'm so glad that we're actually bringing up the COVID-19 pandemic, because as what was just said, there's so much that is a result of it, that we wanted to get back to our lives as we knew them. And so the world just moved past it, it feels like, without really talking about the long-term effects of it. And so, and you all both just mentioned so succinctly so many of those effects, and we are traumatized from it. And the conversation, we know as LMFTs what that means, but most people don't know what that means. And so they don't know a lot of the effects that are happening, and seeing kids that are arguing with other kids in their schools at the time that when they left, the arguments look and sound like that. And parents not understanding how to help, teachers and administrators not understanding how to help. So this is such an important part of the conversation that we need to be having about what's going on with kids today.
And I think, Ashley, too, to sort of piggyback on that, I don't know how many people in this audience really understand how MFTs are different from people who are trained to work individually with psychotherapy. Like, we look at the well-being of our patients and our clients in relationship, in a context. So we consider the impact that the relationships with significant others and the relationships that they have in the communities in the world that comes together. And that's what makes us different. That's what makes us systemic thinkers. And so it's critically important for us to consider these external events that impact our internal well-being.
Absolutely.
Yeah, thank
And
you.
just to piggyback on what you guys have been saying as well, because I think you brought up something really important, Paul, when you brought up these labels, right? And when we think about kids, I think about identity formation, and I think about how once COVID-19 hit, I mean, we can kind of transparently say we're having a lot of conversations about a lot of things, and we are absolutely segregating people into these buckets of what's good, what's bad, what's othered, and what that even means to be othered. And so when you think about a kid going through identity formation, where I'm trying to figure out who I am in the context of the family dynamic, the system that I grow up in, the community that I connect with or I identify with, as well as this world of possibility that I could also connect with, that I'm told could be bad, wrong, no longer allowed, right? When we even look at the things that are happening recently in this country, I think we really have to identify kids get so much information just hand delivered to them in seconds with devices, with social media, and we are not having follow-up conversations. Years ago, if a kid heard a term or they heard something from someone else, there was another adult that they had to have a conversation with to get more information with, and that's not happening anymore. So I'm making very, very big developmental understanding schemas within my own mind connected to myself as to whether or not I have placement, whether or not I have value. And that absolutely shows up in my relationships, how I function in systems, how I function at school, in the community, how I see myself in the future. So yes, you have kids walking around who, you know, it feels like from one day to the next, they turned into completely different people. I don't know how to connect with my kid anymore. I don't know how to reach them because they've been making huge, huge developmental leaps without our input. So when we say like, sitting at the dinner table with no devices so you can really understand what's happening for the 12 hours I didn't see you today, right? What were the thoughts that you had that I had no insight in? What is the language behind some of the slang that you're using? Like, is it just, you know, kind of everyday language, or are you really kind of having a bigger impact in your own life that I probably should have some insight into so we can have bigger conversations? I think there's a lot more going on that we need to make time for. But I also recognize that as adults, we're also struggling with some of these things as well. So how do I take care of myself?
Right.
How do I stay present for my kids and have lasting impact so that they know how to be and remain safe while still doing it all, right? We still got to go to work and we still got to pay these bills. And I think we're oftentimes not acknowledging the weight that's on all human beings right now.
Yeah, and I think, Octavia, that's critically important. You mentioned something we talk about in therapy as this parallel process that we as clinicians have with our patients. And so I think Ashley spoke to this, that we as parents need to recognize that we're having this parallel process to our kids, right? Just like our kids are looking at all these social media sites and figuring out how they can be the best, whatever, parents also are subject to. There's no shortage of people who want to tell parents how to be great parents, right? And so that standard has gotten really high, and the cultural element of being a parent, the religious aspect, like the community, the micro community has gotten diluted. And I think that we can return to the relationships and micro communities, you know, that's to figure out how we can be good parents in that context.
All right, we need to move to our next segment, which there's been so much wisdom shared already. The next segment's going to focus on solutions for families, therapists, and communities. And there's many on the call today who are therapists, many who are parents, and many who are community leaders. And I guess it comes down to, you know, we have these systems interacting with each other, the relationship, the family, and then the communities in which they exist. And then you have also the social media, which really has changed how information is communicated across these systems in interesting ways. But what are the solutions? We've heard many already, you know, relationships. I love it that seems to be kind of our common factor today is let's get in the same room together. We've heard about getting our feet in the grass, get outdoors, have recreation. We heard about intentionality. But what other ideas do you all have? And this is kind of a round robin section, so anyone can go. But kind of the overall question is, from burnout to limited access to care, families are facing mounting barriers. At the same time, therapists are navigating vicarious trauma and resource gaps. What does real sustainable support look like for families and therapists alike? And anyone can go first.
It's a loaded statement, sustainable support. Because what I want to harp on is, yes, I think as a society, we do need to get back to being able to connect, to attach, right? Attachments are such a necessary part of human function. And I think that's why we have these consistent dysregulated systems. We just don't really have the ability to be that sustainable. I can't be tapped into in the way that I used to, 30 years ago, because I'm already spread across multiple systems in a way that is different than it was 30 years ago. But can I have moments, pockets of time where I could absolutely be tapped into, whether I'm connecting with college friends, or even if I'm having a weekend with family, whether the phone call that I have, I decide to be extremely present with that person on the phone. I think that this idea of trying to find sustainable supports in other areas with other places and people, like outside of my individual family unit or the immediate community, is a little bit difficult, because what we then tend to see is when that leaves, right, people are completely just gutted and they have no ability to kind of rebuild quickly back from that, versus if I know in this moment at this time I'm able to receive what I need, or I'm learning from this person, maybe they're teaching me a different way to move in my environment, maybe they're teaching me a different way to be with my emotions so that I don't feel as reactive to the fact that I have grief, or I have anxiety, or I am sad about how things have changed so quickly in the past year, 5 years, right? In those moments, I can receive a significant amount of support that I can carry with me. But I think it is hard to create sustainability right now because so many things are changing, and that ever-present changing is trickling down, right? Everything has a trickle-down effect, even when we think about our nervous systems of, how do I go back to safety? How to go back to ground? How do I get back to zero? But I would say number one would just be move, and move in a way that whether you are moving towards a person, towards outside, towards art, towards music, move and see how your body responds and then go from there. I think, again, we're very calculated. What's this going to do? What's this supposed to look like? What's the, exact result? It has to be this, that, and the other. And then we lose a lot of time and then we're still in the same place. So my number one suggestion would just be move.
That's so nice. I think about the word isolation comes to mind. We know how much we need to heal in community with others. Several years ago, I started a group called Therapists of West Los Angeles, and this has been a space for therapists who experience a tremendous amount of exhaustion and burnout, just like parents do, where it really just started at a coffee shop, and it was just a quick call to the community that said, who wants to meet at a coffee shop? We had 25 people come to the very first session because people really crave and want community. And so really in terms of that theme of moving is recognizing what makes me come alive even a little bit. Is that a walk in a tiny small group? Is that a board game? Is that going to a museum and looking at art with other therapists or other parents who understand, and finding those pockets of time and being willing to be that leader, even if you are introverted or even if it's not your go-to typically, who will just initiate a moment with 1 or 2 other people, or 10 or 20, or maybe you reach out to your whole listserv from graduate school and you say, hey, I know we're all isolated. Is anybody free next Sunday to meet at this ice cream place? I'll be there. And just hold the space for 35 minutes and see what happens. Because the more we add up in terms of doing these things, it really truly does make a difference. And this is true for new parents, for parents going through any particular phase. Finding another parent who's saying goodbye to their high school teen going to college changes everything. Someone who understands. So really remembering that we all feel this way and we all need it. So don't be afraid to create it.
Yeah, and I was actually going to mention that, Maria, around creating these spaces, spaces for conversations. If it doesn't already exist, be brave. You start it. It might start with two individuals to have this opportunity to have ideas shared and a way to create the sense of safety and hope. And also, I think it's also important as communities to also be mindful of the disparities that exist in systems and communities, and really figuring out ways, okay, how are we talking about it and addressing it? So that way each community has what they need to heal. And it's not going to look like community A, it's not going to look like community B, and what they need to heal.
And we talked a lot during the pandemic about how routines were thrown off. And we were talking about how it is now, how there isn't something necessarily we can rely on things staying the same. And parents, I think you mentioned it, Octavia, are stretched thin. And so what routines can we put into place? What kind of predictability can we bring to a child's life, even if it's not a big routine? If it's that there are a couple of things in the day or the week, depending on your situation, that a child can depend on, so that in thinking about when children or when therapists have families coming into their office, that they're not just having to focus on, they're able to focus on what's most acute in the moment, where rather than having to give emergency level interventions in the moment. And in that way, we might be supporting people who are giving the care as well. It's one of the things that Maria and I are really focused on with parents is giving them small attainable tools so that, and things that are really possible to implement so that the trickle down, it's helping them, it's helping the children, and then maybe even the therapists and healthcare workers like us who are also experiencing incredible amounts of burnout at this time.
Yeah, I'm going to piggyback again on what Octavia said. So in terms of sustainability, and I think that looking at this construct of sustainability is critically important. I wrote a book a couple of years ago called Fragile Power: Why Having Everything is Never Enough. And I think that if we look at this in the system, right, if we look at this in the culture that we live in, there's this constant need to have more. And I think we need to be conscious about what more, like what's motivating us and how much is enough and more of what? Do we need more stuff? I don't think so. I think what we need more of is not quantitative things, but like qualitative things. Like we need more love. We need more health. We need more human connection. We need more respect for each other. We need more integrity. We need more truth, right? These are the things that we need more of in our society and our culture. And I think that we have allowed ourselves to be hijacked. We've been allowed ourselves to be hijacked by social media. We've allowed ourselves to be hijacked by marketing machines that tell us that if we just have this European sports car or this designer handbag, that we will be people of dignity and of worth. And my experience is that's not the case, that the patients that I work with, and it gets back to sort of basic tenets of psychology, right? Like Freud said, to have a meaningful life, you need meaningful work and you need love. You need to have true, genuine love with another human being. And you don't need 12 people, right? You need, like, I think the data shows that you need 3 to 5 significant relationships. And so I think it's like returning, because we've gotten really pulled away from who we are as human beings, that we need to consciously return back to being very considered and very intentional about what does it mean to be this particular human being living in this particular concept, in this context. There's a construct called intersectionality that comes out of the social justice movement, where it looks at the human experience as a multiplicity of identities, that we don't allow one significant identity to dominate who we are as human beings, and that the intersection of all of our identities create us as unique beings in the context of our lives. And I think that instead of being told who we are or who we should be, we need to be more intentional about who we want to be and who we are, really at our authentic core. So it's basic, getting back to the basics.
Thank you. Well, we have 2 minutes left, and I'm going to ask each of you to take 15 seconds to, in one sentence, name the one thing every therapist, parent, or community leader should prioritize in supporting youth mental health today. So just take 15 seconds and what's the one thing?
Normalizing emotions.
Right.
Building relationships and connections.
Okay. Good. Octavia, say that again, what you said.
Normalizing emotions.
Okay.
I would say prioritize presence over perfection.
I'm going to say respect for self and others.
And create a sense of belonging where kids know who they are and who cares about them.
Fantastic. I'm going to say all of those. That's perfect. So I want to thank you all for participating in our panel today. And on behalf of the American Association for Marriage and Family Therapy, thank all of our audience. We don't know who you are, but thank you for being part of this powerful and timely conversation. We hope we sparked some ideas that will inspire action during Mental Health Awareness Month. I also want to encourage you to connect with us on LinkedIn. We're all on LinkedIn. That's kind of like not a tea community where it's more kind of like professional. So it's a great way to connect with each other. So feel free to reach out to any of us there and connect with us on LinkedIn. And if you'd like to rewatch or share the panel, it's going to be available on both LinkedIn and YouTube. Hopefully you all will make this go viral, because these are ideas that the world needs to know about. So thank you for your time, and have a great day.
Thank you.
Thank you.